My husband Guy was diagnosed with a brain tumor in 1997, and it was an aggressive brain tumor, and he was told that he probably had about a year or a year and a half to live. He had a very positive attitude, and he wanted to certainly beat the odds, and he actually did live until the age of 52. That was 4.5 years after diagnosis. I think when you're a caregiver, you really think you can do it all, but you can't do it all, and I think that's a really important message. Even as a patient, my husband used to say he was fine all the time, but he said fine stood for fouled up inside, nice exterior. And I think that really spells it out, because people don't really want to hear it all, but you're not fine when you're going through this, either as a patient or a caregiver. Through my work as a Cancer Society peer support volunteer, my advice to caregivers would be to make a list of things that you need and make sure that people see it and pick something from that list that they can help you with. Also, people are not aware of their benefits at work, and I think it's just really important to make sure that you know whether you have coverage, for instance, for nurses or whatever it may be. And then the other thing is just to take care of yourself. You need time for yourself. So if you can have someone spend some time with your patient so that you can get out and do some things for yourself, I think that's really important. When you receive a diagnosis such as cancer, it can be very overwhelming. And looking back now, it would be very helpful to have received some written information right away at the doctor's office so that you can, when you're ready to look at it, you can look at it at home. I think it's very important that a caregiver doesn't try to be a super person. It's important to ask for help and to take help if it's offered.